Good evening. My name is Jennifer Williams, and I am a nurse at Heart of Lancaster. And today I'm going to be talking to you about the benefits of Roux-en-Y surgery versus the sleeve gastrectomy for bariatric patients. So first I want to start and tell you a little bit about myself. I am a 38-year-old mom of 4 kids who unfortunately gained a lot of weight, probably in my mid-20s from overeating a lot of buffets. And I have lost over 101 pounds. I started at about 267 right before I had surgery. I did have the gastric bypass or Roux-en-Y and have been able to maintain my weight since 2012. So today I want to talk to you a little bit about, number one, where we got here or how we got here. So we are going to look at some of the risk factors on how obesity comes about and how patients end up being criteria for the bariatric surgery. So basically we're going to look at obesity as a chronic problem with many contributing factors such as genetics, social, psychosocial, behavioral, cultural, and metabolic. So when we look at cultural, if we have the Spanish culture, they eat a lot of flour. If we have different types of ethnic groups that eat a lot of fattening foods, that's definitely going to put you in a higher risk for category of obesity. So previous diets cause the body to release hormones that make your body gain weight over and over again. So even when we're doing the yo-yo diets, the cycle of weight loss and gain can increase and cause other medical conditions. Some of the benefits of achieving the lasting weight loss with bariatric surgery is going to be reduction in some of those medical conditions that occur, like type 2 diabetes, hypertension, some of your cardiac conditions that will be better controlled, hyperlipidemia, and GERD. Another one that's actually sometimes even cured because a patient has the weight loss surgery is sleep apnea. So with sleep apnea, a lot of times the fat or the pressure causes on the diaphragm causes you to snore. And when you snore, you're cutting off oxygen to your body. So if I go in my sleep, that's a sleep apnea, but it's cutting off the oxygen to my brain, heart, and other vital organs, which in long-term use or long-term exacerbation of that sleep apnea is going to cause problems. So we look at the comorbidities in 2 groups according to an ACSH study. 37% of those people in the gastrectomy vertical sleeve group had a partial or complete remission of their diabetes compared to 45% of those in the bypass group. So if you look at your odds of having 30% chance of recovering from something versus 45% of recovering for something, I think I would probably take my 45% odds. Another great thing, a benefit of achieving long-term weight loss is the physical ability to move around more. I know for me, that was one of the drivers. I wanted to be able to play with my children more. I wanted to be able to run with them and play softball. And I was just not going to be able to do that. I already had a lot of wear and tear on my joints at that time. My knees and hips started to hurt. So are you a candidate for the gastric bypass sleeve? That's what we want to look at now to even identify if you are a candidate to have these procedures. A lot of people say, oh, I'm overweight, I need to lose 100 pounds, but is that realistic? No, it's not. If I'm 170 pounds, could I stand to lose 100 pounds? No. Maybe 20? Probably, according to the BMI chart anyways. So we are going to take a look at our BMI chart, and I'm going to give you an example. So if you look here, you have your patient that weighs 175 pounds and they are 5'4", so they are 30 on their BMI. But if you look over to the side, this is a overweight obesity category number 2. So that's going to be definitely a concern for your patients. So you would actually meet the criteria if you are at a 35 for a 39 for the sleeve gastrectomy, a 35 with one serious comorbidity. So advantages are produces significant long-term weight loss, which is 60 to 80%. or the sleeve produces about 50 to 7%. And this is my person that's actually listened to my presentation. So say hi.
Hi.
Thank you. It also restricts the amount of food that can be consumed, so it may lead to conditions that increase energy expenditure, produces favorable changes in the gut hormone renin, which is actually cut off in the both the sleeve and the gastric sleeve or gastric Roux-en-Y bypass. So typical maintenance of 50% excess weight loss, and then we also looked at a JAMA study with an estimated mean percentage of weight loss of 5 years was 49% with a sleeve gastrectomy versus 57% with Roux-en-Y. Don't you find this so interesting, dear?
What's that?
Don't you find this interesting?
I do.
You do. There's going to be a quiz at the end. I hope you're paying attention. So what are the complications of each? Complications of the sleeve and gastric bypass. Sleeve and the Roux-en-Y both have nutritional deficiencies, so patients already who are having a concern with not having, I totally lost my train of thought. Sorry. Okay. Patients who are having a vitamin deficiency already are going to be a great concern. So we have studies that show that in the state of Florida, a recent study by the CDC showed that patients are not, or the general population are not absorbing vitamin D well. So if you, every patient who's normal already has a vitamin D deficiency and needs to be on medication, just think of the patient that doesn't actually absorb any because you're removing all your intrinsic factors. So some of the complications also is going to be the sleeve is you're going to have colicky abdominal pain and vomiting. And a lot of patients are put on Gas-X or Beano to make them stop passing gas. So in my professional opinion, I believe that the Roux-en-Y is the best weight loss or bariatric surgery for patients. I feel like it has less adverse effects and greater outcomes. Thank you.